Okay, I think we should begin. So welcome everyone, and thank you for being here. My name's Drew McCartor. I'm Pure Earth's Executive Director. Before we get started, just a couple of quick points. Please keep your microphones muted. If you have questions at any time, there is a Q&A box below, and we will make sure to save about 10 minutes at the end of the webinar so that we have time to address your questions, as that's often a very interesting component. This webinar is part of a series of events hosted by Pure Earth for the 10th Annual International Lead Poisoning Prevention Week. And today we're going to be focusing on what can be done to identify and eliminate sources of lead exposure, particularly lead-contaminated products and foods, both at the national level and within global supply chains. And we're going to explore the interesting links between data that's collected in New York City through a really innovative and novel program there, and work that's being done outside of the US to eliminate lead contamination. Particularly, we'll look at a case in the Republic of Georgia. We're going to begin with a short video called Solving a Toxic Mystery, which focuses on Georgia and what was done after it was discovered that 40% of Georgian children had lead poisoning. And then after the video, I'm going to introduce each of our three excellent panelists, and we'll hear about their work and experience on this issue. And with that, let's begin by watching this short film. I'm sitting on top of a stone tower in the far north of Georgia in the region of Svaneti. We are pretty high up in the Caucasus Mountains. Pure Earth is working in Georgia because of a challenge regarding childhood lead poisoning. In 2018, the government, in partnership with UNICEF, discovered really troubling levels of lead in kids' blood. In fact, 41% of the kids that were tested had dangerous levels of lead in their blood. The government asked Pure Earth to help figure out what was driving this lead exposure. Where was the lead coming from? How was it getting into the bodies of these children? And to do that, we visited the homes of many of these lead-poisoned kids and tested the foods, the products, the toys, the paint, soil, the water, everything that we could in these homes, and discovered that overwhelmingly it was actually spices that were contributing to their lead poisoning. And the reason that the spices were doing this was that certain producers were adding an industrial pigment to their spices to make them brighter yellow, and that pigment was about 50% lead. So we studied that pigment and the spices and confirmed that indeed that was what was being put in, and that was what was driving the lead poisoning. Could you describe for us what the next step was to identify and learn more about this spice contamination?
We assess 77 vendors around the country. Up to 300 spices was tested, and average concentration was exceeding to that level which is allowed in the country at 600 times. They did not know, even when we had some monitoring and interview with them, they didn't know that it is so poisoning. They are using just the color for the color of the product they are producing.
Pure Earth has been working in Georgia with the government, UNICEF, and other partners to try to address childhood lead poisoning. The activities that we've conducted here have included public awareness campaigns, an information campaign for spice producers, as well as assessments of contaminated sites, and work directly with producers to ensure that they're no longer adulterating spices.
Between 2020 to 2022, there was a 100% decrease in the entire region in the number of lead-adulterated spice samples, while 96% was in Tbilisi, 76% in Emirati, and 88% in Korea regions.
So of course, we are going to keep pushing forward to ensure that Georgia's unique and honestly very delicious cuisine is safe for children across the country. And we also want to compliment the government that has been really proactive and also really aggressive in tackling this problem. So it is no accident that today we're going to be discussing both work in the Republic of Georgia and monitoring work that's being done in New York City, because the linkages between these two efforts are actually really interesting and tight. In fact, when we first worked in Georgia, we did not go in blind regarding what sources might be contributing to exposure. We had the benefit of a lot of interesting data that was coming out of an effort by the New York City Department of Health and Mental Hygiene. And we're really fortunate today to be joined by Dr. Paromita Hore, who runs this work. So now let me introduce Dr. Hore. Paromita holds a master's in public health and a PhD in public health risk assessment from Rutgers University. She's the director of environmental exposure assessment and education at the New York City Department of Health and Mental Hygiene. She's been with the department for nearly 20 years and provides technical assistance on issues related to environmental exposures. Dr. Hore, could you tell us about the work that you've been doing for so many years and how that work feeds into work outside of New York City?
I certainly can. I came ready to tell a story. Thank you. Hi, everyone. It really is a pleasure being here today. Thank you, Pure Earth, for the invitation to present today. It is a pleasure and a privilege to work with a global community who are working to reduce the burden of lead exposures around the world, and which is a hefty task, but I think it's doable. I would like to think it does require collaboration between partners and key global stakeholders. So New York City, we are a local authority and we have local jurisdiction, but partnerships with organizations such as Pure Earth help us to take these findings and our data across boundaries and help to inform investigations and make some of these changes that we are speaking about today. So today I'm going to talk about exactly our experience around lead in spices from Georgia. And also, how did we find out about these as a potential lead source in the New York City residents, as well as potentially abroad? And what did we do about it? So you can see my screen, I hope? Yes.
You can.
Just trying to maximize, okay. So for those who may not be familiar, just want to give a brief background on our surveillance system in New York City and how we get to learn about lead-containing consumer products. So broadly in New York City, certain populations are required to be given a blood lead test as part of the law. And these include young children, pregnant individuals who are at risk for lead exposure, as well as workers who work with or around lead. And we at the health department, we get all the blood lead test results for all New York City residents, children and adults, which amounts to hundreds of thousands of blood lead test results every year. And we have protocols in place to conduct follow-up investigations for individuals with elevated blood lead levels. And as part of this follow-up entails administration of a risk assessment questionnaire, an interview. We speak with the families to determine what are the potential lead sources. Within this interview, we also ask about product use. And if the investigator feels that could be a potential lead source, they collect samples for lead testing. We also conduct undercover routine surveillance of New York City stores, looking for implicated products that we may have learned about from case investigations. So all of the products that are tested by our department for these evaluations are systematically cataloged and tracked in a database, right? Along with product related information such as the product name, distributor, manufacturer, when available, where the product was purchased, lead content, made in country, etc. And why is this important and how has this helped us? Well, systematic tracking such as this has helped over time, has helped us to basically monitor for trends in the types of lead containing consumer products, oftentimes, most of the times from around the world, associated with elevated blood lead levels. And it also has helped us identify at-risk communities within New York City, right, who may be at an increased risk because of using such products. And through this investigation system, we have identified a variety of lead-containing consumer products from around the world. These have included health remedies, spices, food items, cultural powders, novelty items such as amulets, jewelry, as well as cookware. Naturally, as New York City is a melting pot, and we are investigating cases within this melting pot. So this is how we came to learn about spices from Georgia. We started seeing extremely high levels of lead in samples of spices obtained from Georgia, as high as 78,000 parts per million lead, which is considerably high when you compare to, let's say, most food additives should not contain more than 2 parts per million lead. What our data showed was that the spices purchased or obtained abroad were more likely to contain extremely high levels of lead compared to spices that were purchased in the United States. We also looked at our spice data for a 10-year period between 2008 and 17. And what that data showed was that over 60% of spices purchased in Georgia and sampled during that time had concentrations greater than 5 parts per million, which is the permissible limit for food in Georgia. What would we do if we were to find such spices with elevated lead content in New York City? Well, we would take enforcement actions, again, right, to stop businesses from selling these types of products. If it's within the United States, we definitely would notify our federal partners. They have national jurisdiction, but most of the samples, if not all, were coming from abroad, right? So the enforcement, local enforcement would not be effective in such a scenario. So a couple of approaches that we took: risk assessment, risk communication. We wanted to raise awareness amongst New York City residents who may be using such spices about the potential for lead exposure through these types of spices, particularly those they have purchased abroad, and seek out and get a blood lead test. Speak with their doctor, get a blood lead test if they are using spices purchased abroad or sent from Georgia. And the other thing we had done, we have now a lot of data because we systematically track the product testing data along with the blood lead level registry information. We shared our findings with the Georgian authorities via our New York City Georgian consulate in 2011 and in 2015. And in 2017, actually, the Georgian National Food Agency got in touch with us for data, and we provided line list data to them for further investigation. Lots of work has been happening in Georgia that we'll hear about probably during this presentation today. all likely contributing towards a decline. We are seeing a decline in the number of children with Georgian ancestry with elevated blood lead levels. We've also started seeing a decline in the number of samples with detectable lead. So it certainly is promising and quite fulfilling to see. And of course, we'll all keep monitoring. In closing, I think I just want to say the New York City's data repository has served as a global indicator of lead-containing products from around the world. Many times, most of the times, the products found to contain elevated lead are coming from abroad, made in low and middle income countries. And really, the source control is the solution, and we need data to support that. So this is one approach we've taken to build the data at a local level in New York City, because there needs to be evidence-based investigations at the countries of origin and to help reduce the global burden, and with the help of engaged global stakeholders, including governments abroad. So thank you.
Thank you so much, Paromita. Those 4 conclusions, I just couldn't agree more with them. And the point about the New York City database being a global indicator, we know that firsthand because we use it as a bit of a roadmap to guide our work in low and middle income countries. And it's been just indispensable for that. You have perfectly teed up our next presenter. And we have a perfect segue now to learn more about what has happened in the Republic of Georgia. Our next speaker is Dr. Khatuna Akalaya. Khatuna is Pure's Georgia Country Director. She holds a master's degree in environmental management and planning and a PhD in biosciences, and has more than 15 years of professional experience in agrochemicals management, including hazardous waste management in Georgia and abroad. She's worked with FAO and UNEP and UNDP and the World Bank and a host of international agencies. She helped prepare and validate the 2021 to 2031 Climate Action Plan, and has experience working on regulations around municipal waste and toxic waste, chemical substances, and management at the Ministry of Environmental Protection and Natural Resources. Khatuna, welcome and thank you for being here. And I hope that you can describe for us the context in Georgia, starting in the 2015 and 18, and then in particular, what work was done there in the last 4 years, and what motivated all of these actors to do this work in Georgia?
Thank you, Drew. Sorry for my voice.
Oh, I should say that Khatuna is so generous to be with us because she's not feeling well, but is going to suffer through this regardless. Thank you.
And I hope it will not disturb too much you, just voice. That's really logical to continue the speech which was done before. And generally, we started to assess the situation in Georgia regarding spice adulteration. And it was obvious. Generally, the history starts in 2000, and even 2006, 2013, there was, it seems, the case, because when I read the literature, it starts, there was obvious, there was the case when the adulteration was done, but not with this scale. Generally, my team in Georgia, you see them here, and we did quite a lot. We are working on the site assessment and contaminate site assessments and things like that. But I will focus only for the spice adulteration. Next, please, Angela. So to work together with my team, we have really very good partners. So one of the main partner in the country is UNICEF, who was really pioneer to start the be a blood level testing for the children. So it was quite interesting. And from the beginning, when the UNICEF was initiated, that activities together with the National Disease Control Center, they really were successful, and the whole, around the country, the people started to think about what happens, and that was the first message to the just normal ordinary people, that there was a threat from spice. And all the national organization, National Food Agency is really very active, and they are really very, very widely collaborating with us. They are interested for everything, and even they would like to do joint assessment of these bazaars, as we did 2 rounds we already had. Please, next. As you saw, there was the question when it was started, and it was started really in 2017, when the information from New York City came to Georgia, the official letter that the adulterated spices, which was during the home-based assessment of one of the families, revealed that the spice was from Georgia. And then officially addressed, National Food Agency was officially addressing to get this information and prove it. So as you see in the map, there are the western part of Georgia, which is really very high demand and high cultural habit to use the spices, and that's why we have this purple color in the dots, where we have the high level of lead in the spices. Please, next. Why we started? Why? Generally, it was really very interesting that in 2007 the information came from USA, and the government of Georgia issued the regulation. And the regulation was enforced in 2018, and the monitoring and the control was very strict. One of the vendor I wrote here was mentioning during our interviews that the inspectors are not really very often visiting for control, but after this case, which came from New York City, it was started very often and activated. So next, please. Generally, government really, I agree with Drew that they were really proactive. With the support of UNICEF. I don't want to lose that effort from UNICEF, because it was suddenly picked up, that information that the child had a high level of lead in the blood. So that was one of the important push or important drive case. But I don't want to, I really would like to mention about the association agreement, which was signed in 2014 with the Georgian and European Union, and the regulation should be harmonized. So in till 2014, the regulation should be harmonized on the phytosanitary and sanitary and phytosanitary the field. So the old regulation should be harmonized with the EU directives. So one of the strengthening the capacity of the country was really linked with this effort. And DCFTA, it's a deep and comprehensive free trade area, which means that trading, and the one of the requested product is a spice, and a very cultural one. So, but I want to say also that generally government of Georgia, as I told, the regulation was issued in 2018, and National Food Agency was very active. Please, next. So, so that was done, that the state program, before state program, the UNICEF and NCDC started to check the blood lead level in the kids, in the children between 2 years old and 7 years old. It calls multiple indicator cluster survey, and it was really revealed that the high blood level was among these small children, and 41% was the amount of the children where we had a high level of lead. Please, next. And I would like to say that in Ajara region, it was amount of the children which was tested in Ajara region, 85% was with a high BLL. Next, please. UNICEF was really supporting the set the laboratory. I mean, establish the laboratory under the NCDC regulation, and they support to have the laboratory there. And still, that is a process, and the surveillance system, which is initiated by UNICEF, is still under discussion with the NCDC. And it will be really very good, and the Pure Earth has really good chance to have participate in this surveillance system as a in the part of the home-based assessment, when the surveillance system will reveal the families with the high level of lead in the blood. So then Pure Earth could do the home-based assessment. We had a meeting with the experts from Norway, who are consultants of the UNICEF under this project. So it is really real, and we could start very soon as a model in Ajara region, because it was already discussed with the regional Ministry of Health of Ajara region. So I think that was I wanted to say, and if I am not too long. Thank you.
No, that was perfect. Thank you so much. So it sounds like there were really a variety of factors that kind of motivated action in Georgia. An early one was the communications from the New York City Department of Health, essentially kind of warning the government about what their findings were. Then, of course, the 2018 National Blood Lead Level Monitoring results showed that indeed this contaminant out there was creating just an enormous lead poisoning toll. That was then confirmed by in-home assessments, and all of those things together motivated a really robust regulatory enforcement reaction, and then UNICEF, Pure Earth, and others to design these supporting programs around spice monitoring, child health monitoring, and the like. Perfect. Thank you so much for that, Katuna. And now what we're going to do is kind of zoom out again And we'll hear from Rich Fuller. Rich is the president of Pure Earth, which he founded in 1999 to bring attention and solutions to the issue of pollution and its impacts on communities worldwide. In 2017, Rich co-chaired the groundbreaking Lancet Commission on Pollution and Health, outlining the enormous health and economic costs of pollution, and co-authored The Toxic Truth, which serves as a foundational resource for understanding childhood lead poisoning. Very apropos of our conversation. This month, Richard was included in the Future Perfect 50 list from Vox, recognizing the scientists, thinkers, scholars, writers, and activists building a more perfect future. Rich, we've heard about the work being done in New York and how that influenced work abroad. And I wonder if you could tell us what we're learning about lead in global product and food supply chains and what can be done to reduce these kind of transboundary exposure sources.
Sure, thanks, Drew, and thanks, Paromita and Katuna, for really updating everyone on what's happening both in New York City and in Georgia, of course. I think what's really interesting about this is when we start to drill in about how much this problem in Georgia and in other countries around the world actually are impacting people in the US. And as you know from Paromita, many cities are funded by the US CDC to go out and do investigations on kids who show up with high blood lead levels, especially when they're tested, you know, as babies or going into school. And we're in the middle of pulling together all of that data from a number of different cities, including Los Angeles, California as a whole, the Seattle area, Oregon, and New York City, to try and work out how much the lead poisoning in the US is coming from these international sources. And I'm a little disturbed to find out that, in fact, contaminated spices or contaminated cookware often is the largest source of exposure for kids domestically here. One of Paromita's data points is that 80% of pregnant women that they're testing actually are being poisoned because of consumer goods, which we know are mostly coming from international sources like this. And some of the early studies, and this is a paper that Paromita and several others will be working on over the next 6 months or so, but some of the early studies show over 50% in these other jurisdictions of consumer goods being the source of the poisoning that's occurring in the US. And I don't see any reason why that should be any different in Europe or any other G7 or OECD countries. You know, we've worried for a long time about paint and pipes and done some great work in those areas and seen a lot of good effort and results coming about. But this particular source now is really coming, I think, now to the fore. So how is lead getting into these goods that we're consuming here in the West? Well, we know it's being added to spices that are being shipped out. It's generally not in the spices that you find when you go to the supermarket, not in the packaged spices. Typically, it's in small stores where they're importing directly, and it's loose turmeric or other products. Certainly, the cookware issue, which we haven't talked so much about here, you may pick up that cookware in, again, small back shop operations, or perhaps it's being sent to you by your aunt as a reminder, or you brought it back from a vacation in Mexico or Turkey or somewhere like that. You might have brought back a contaminated product. We're also finding it show up in the cookware that's coming out from refugees. Interestingly, in Seattle, an interesting paper finding that the aluminum cookware that people are bringing from their home countries has a lot of lead in it, and that's causing quite a lot of exposure as well. But there's also another kind of more insidious background issue going on, where lead that's being released into the environment, mostly from poor battery recycling, it will go into the air and settle down on market gardens or on rice and wheat fields, or into areas where water then becomes contaminated that then feeds those particular products. And we have this global food supply chain now, where products from all over the world get aggregated and used in products that we all eat. And there are low levels showing up now of lead that probably come from these international sources that the Consumer Goods report pointed out, for example, lead in spices. But I think there's also lead showing up in grain crops and other places all around the world. And so it's not just these one-off things of spices and pottery, but this kind of overall insidious poisoning that happens because of our global food supply chain that we need to worry about it. So how do we deal with this? Because this is really, pointing out that this is no longer just an issue that's poisoning kids internationally. It's poisoning kids globally. I can tell you what we started to do to try and get a handle on this. We're out at the moment doing what we call rapid market surveys. We're in 20 or 25 countries going to marketplaces where people are normally buying their spices, their pots and pans, their rice and commodities. And we're testing samples of all of these things in all of these countries. And this will give us an idea of where are the main sources of different products that are heavily contaminated with lead. It's still a long way for us to go to finish this project, but it's a great way to get an early start on all of this. But I think there's so much room for us to be doing much, much more in this area. And if there are bilateral donors or philanthropists or people who are concerned about this issue, we really encourage people to get involved and find ways to help people who are working internationally on lead exposure, and not just because of the concern for those populations, but for the concern for the exposure that's happening to our own kids back at home. So international work really needs to focus on lead nowadays. And our work domestically, worrying about lead in the wealthier countries, needs to shift away just from these domestic sources that we've had for so long, and now look at these international sources, because that's where the exposure is coming from. So I'll pause there, Drew, and turn it back to you.
Yeah, thanks, Rich. You've hit one of the 4 conclusions from Paromita's presentation also, which is the necessity to solve this at the source. This is not a problem that we can inspect away at the borders through border control. Contamination happens in a geographic location, and that's where the solution has to be, addressed to. Yeah.
Can I just address that thought? Because a lot of people think, well, why don't we just put more controls and make sure the stuff that we're importing is tested and do it as border controls? It is, in theory, doable, but the practicalities of doing that are just impossible. Right now, we test less than 0.01% of products that are imported into the US. In Europe, it's 0.015 of products there are imported, are actually tested. By the way, when they test them, they find about 5 or 10% of them are often contaminated, which is really disturbing. But we just can't, getting higher than that level would slow up international commerce to a way that is absolutely unacceptable. You can't halt and slow, especially perishable goods, from coming across boundaries and do these tests in a timely fashion. So it's not a practical reality to actually halt global commerce in this way and do these studies. So while it sounds like a great idea, it's not going to work.
And of course, the other challenge is if one country rejected a product at its border, that product still exists in the global food chain, and it will end up in another person in another country. So this, all people being equal, this doesn't solve the problem. It might only reduce it in one place and push it off to a second place.
And if I may, just one point is also people hand carry, right? That many of our cases are bringing the products from their home countries. So,
yeah. And grandma sends it over because, you miss the hometown and you want to, remind them of these wonderful different things, and grandma doesn't know, of course, and so it goes. You just can't stop this sort of thing.
There's one result out of Georgia, Georgia being such a great case study for solving this at the source. There's one result out of Georgia that I just wanted to share with everyone because I have the privilege of having the data in front of me. And that is, as part of Pure Earth's work, we took a little over 300 spice samples before our interventions, and then the same number at the same markets after our interventions. In the most troubled regions, the average concentration of lead in these 300 odd samples was about 360 parts per million. That was the average lead concentration. Today, that average in the region of Ajara is 4 parts per million. So nearly 100-fold reduction in just, I guess it's been three or 4 years of intervention. So they've also seen really encouraging similar results in Bangladesh. So anyone who is on the line looking for good case studies should really look into what was done in both of those countries as really positive outcomes. Now, we have several questions in our chat box, so I'm going to turn to those and pose it to all of you. Anyone who feels like answering this first one, I think, would be relevant. So the question is, can you expand on your monitoring capabilities, both blood lead levels and spices and other environmental media? I'm curious if there are any other important routes of lead exposure in this location, confirmed or thought to exist. I think that probably means Georgia, since we're talking about Georgia, but might be New York as well. And then great job to the team. So monitoring capacities and other sources of exposure.
Can I jump in very quickly? I think you will have more technical detail, Drew, than I would, but in order to discover that it was actually spices that were causing the majority of the impact in Georgia, we did a house assessment of, I think, about 100 houses in Georgia, going through and testing everything in those houses, the cookware, the paint, the soil, obviously the spices, et cetera, et cetera. And it was from that assessment, which is a published paper, by the way, that we realized that 90% of the high levels of lead were coming from the spices. So we don't see any other significant exposures from that particular assessment in Georgia other than the spices, which is perhaps unusual because we expect there'll be more exposure pathways in other countries as we do this sort of work in other countries. In terms of monitoring, really we need to acknowledge too that it's the government of Georgia who's been responsible for doing most of this work. We've been there as their advisors, as support to them. They have now a strong, robust monitoring system in place to check on blood lead levels as time goes on. I'll pause because Katuna and Drew will know much more than me.
Katuna and Paromita, do you want to make any comments about monitoring capabilities and other sources of exposure?
I echo what Rich just said. When we do the evaluations or the risk assessment questionnaires in New York City, it's not just asking about one source. It's specific interview questions devised for whether it's a child or an adult, because the exposure routes may vary, the risk factors may vary. So we do ask about other types of sources or potential exposures. So that it's a holistic look at the risk factor for the elevated blood lead level. And as far as blood lead monitoring, luckily we receive funding from CDC, as you mentioned, right? There are CLIP grantees, which is the Childhood Lead Poisoning Prevention grants, given to various jurisdictions across the country. And part of that is basically blood lead monitoring for children, young children. And many of these jurisdictions are also doing this sort of an evaluation of what the lead risk factors are. And it's a model that's worked for us. It's a model that's working for Pure Earth as you're doing these home-based assessments, because you go into the home, you want to know how the lead is getting into the body. One thing that we know about lead is lots of things we know about lead, right? There's a lot of literature out there. So lead is lead. And there are a finite amount of routes of exposures. It's really just kind of investigating and scaling down what the risk factors are. So.
And if I could add, in my years of work on this issue, we see a lot of different types of interventions on sources, but what's really missing out there, what too few actors are implementing, are monitoring programs, both blood lead levels and in-home source assessments. There aren't that many people out there. There aren't that many government agencies that are doing this type of work, particularly in low and middle income countries. And it's very difficult to solve a problem that you don't understand fully. And this is the way to understand it fully. We have another question in our Q&A box here. Could the panelists talk about any resistance or pushback they've received in the Georgia case or other cases if lead is being added to spices to make them more visually appealing, which we know is the case, for consumers, there might be resistance by merchants or manufacturers who worry about lost sales? Khatuna, you interviewed a lot of spice producers. What was their attitude about removing this colorant and pigment from their products?
Yeah, aim of the using of the pigments for spice as additives for spice due to the attractive, to become the product attractive. So that was sometimes they was also mentioning that it could be heavy also than the spice itself. We heard a lot about that issues, and it is really very difficult to. It's an economy wise, so it's some profitable action which vendors are doing. But while the pigments exist in a country, it will be still problem. In 2020, in December, there was the regulation which was cutting any kind of pigments and the paints with more than 90 ppm of lead should stop to enter into the country. It could help, but the old kind, the pigment which is the powdered still exists. I mean, remnants of that pigment. It's not imported anymore, but still there are. And it is necessary to keep the control and monitoring from the government. If the government will, not control strictly that activities, it could again come to reality. And regarding the monitoring and the when we went to the home during the home-based assessment, for example, we had one of the family, and we had the several sources: paint on the wall, teacup with the paint with the colored paints, and the spices. Can you tell me which one was dominant for that, and what was which could be the most influenced one for the kids? So it's really very difficult to search to say, and we are on the process of learning a lot, and there is never I wanted to find some answers. There are a lot of questions, but one answer there is not exists. So it's quite difficult.
Thanks, Khatuna. And if I could just add a little bit to that, what we have seen in the countries that we've been working in is that they usually have adequate food safety laws on the books. Yeah. And the weakness is often in monitoring and enforcement. And so as a nonprofit, we don't get involved in enforcement, but we can add to the capacity of monitoring. And the question was about resistance from producers. And so what we've seen is fundamentally, they're already breaking the law. So even if there is resistance, it's not a very valid resistance because they're breaking their country's law at the expense of those children's health.
Yeah.
Not a ton of sympathy for that.
Yes, exactly.
We have a couple more questions here. I'm going to pose this to any of you that feel like answering it. The question is, do we see lead in water as a major concern?
May I?
Please.
Lead is not soluble, and its salts also, they're not soluble in water.
Yes.
So generally, when you find lead in water, it's there as small particles that are just being held within the water until they finally settle out. And so lead particulates can come in from dust being blown from one place or another, but generally they will settle rapidly either onto the stream bed or onto the bottom of a pipe, often within a few hundred meters of where their source is from. So finding lead in water means that there must be a source very close by. And it doesn't show up kilometers down and away from it. You don't find lead in water kilometers away. So we don't see lead in water as a key focal area. Lead, for the most part, is a problem with soil contamination. And the exposure to soil comes from many different industries and sources. And then kids will ingest the soil as dust when they're playing in backyards. Ultimately, obviously, we know about lead being added to products where kids are again ingesting it. But it's these sources that are more important than lead in water. Paromita, would you agree this is a reasonable way to describe it?
I think I can speak for in New York City. The water is routinely monitored, and it's really not one of the risk factors we think of when we talk about lead and lead poisoning.
I can speak to that preliminary piece of data, the preliminary results that we've gotten back from these 5 other jurisdictions, that lead in water, which would have been a pipe very close to the drinking source, it only shows up less than 1% of the time as being the source of lead for that kid who has exposure in the US. So it's it's currently quite a low exposure risk comparative to these other issues that we're talking about from consumer products.
Thank you all. We have another question here. We have actually a number. Hopefully, I think we have time to get through the 2 more that are in our chat box. The question is, there is an urgent need to initiate a global treaty on the control of lead through UJEA. I'm not familiar with that acronym. Someone perhaps can inform me. What effort can your organization do to achieve this role? Approaching the problem of lead piecemeal I think it means to say, will not solve this global issue. That was submitted by Dada in Nigeria. Thoughts on a global lead treaty? We have a mercury treaty and one on persistent organic pollutants. Is there a need for a lead treaty?
May I again? I hate to, sorry guys, to hog I think a lead treaty is an excellent idea. Whether the international community is willing to do a lead treaty, there needs to be a lot more groundswell amongst the main countries. And I imagine that Mr. Dada meant UNEA, UNEA is my guess. Right now, UNEA has just a small focus on lead. The good news is that the G7 is very interested in lead. We also hope that the G20 may pick up lead as an issue. These may push back to United Nations Environment Program and perhaps to the UNEA for a stronger resolution on lead. I think it's going to take a lot more work for us to get there, but we would be thrilled if something like this would come about.
If I may add one more thing, I think there's definitely a stepwise approach for this big issue around the world. So one thing that can perhaps support a treaty one day is data. And I mean, as we've spoke about, we have this data repository here in the city, New York City, but a national data set, for example, to get a glimpse of how big is this issue, international, perhaps in different key cities, etc. But building the data to then essentially build the evidence, right? Is this a real problem? I mean, we're getting symptoms of, we're getting a glimpse of all of this, but there needs to be really robust data.
just to complement that point, the countries that we have noticed where the national government is most active and interested are those countries where local national data on blood lead levels and sources has been generated at the national level, not flown in internationally, but generated by that government. Very difficult for a government to ignore their own data. We have another question here, and that is, aren't lead and other metals also added to spices to increase their weight? Has anyone seen the operations where metals are added to spice? Where and how is the lead obtained, prepared, and added? Kotunu, did you end up in the facilities watching this process?
Generally, the process which we also in the video you already showed that when they are packing the spices, it could be added like a color additives. No one, I was telling also in the video that no one knew that it is really poisonous. So that's I'm sure that the problem which related to the lead pigment adulteration in Georgia will be really ended with that. But the process is like that. You are getting from the wholesalers the product and then packing them. And for attraction, you are adding like additives for color. So not for, I'm also sure, the question was that maybe it is not for having, for the weight. It is for attraction, for colorful. Yeah.
All right, thank you. We are now at the top of the hour, so I want to close out by saying thank you to everyone who attended and a special thank you to our panelists. If people have any remaining questions, we welcome you to send them to info@PureEarth. And of course, check out the New York City Department of Health and Mental Hygiene's open access database. It is a wealth of information. As I said, we use it as a roadmap. We hope this program gets replicated around the world. We'd like to encourage everyone to visit pureearth.org to learn more about our work to address global lead pollution and lead poisoning. And I wish all of you a great day. Take care.
Thank you.